Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Alaska public health nurse Lauren Carroll, a Bloomberg Fellow at the Johns Hopkins Bloomberg School of Public Health. They discuss the health and COVID-19 challenges unique to such a sparsely populated and geographically vast area. Let's listen. Lauren Carroll, thanks so much for joining me.
Hey, Stephanie, thanks for having me.
So, Lauren, you are a public health nurse in Alaska. What does that mean?
Well, Stephanie, that's a good question. I guess, like this morning, what it means is I woke up, I looked out the window, I saw beautiful mountains. I live in a spruce forest. But after I get off the phone here with you, I'll head into work. For me, what that means is about a 1-mile hike on the snow trail to my truck, and then work is about 10 miles away. But work itself, I live in an area that's got about 15,000 folks. It's got 4 different Alaska Native villages, 4 different old Russian believer villages. And so today, I'll do what I usually do, is working with communities, systems, and individuals to looking at ways to protect and promote the health of where we live.
You've worked in remote parts of Alaska. You've lived without running water or electricity. Does that make the challenge of being a public health nurse in Alaska different from perhaps other states?
Oh, I think so. I've only worked as a public health nurse in one other state, and that was Missouri. And from my experiences, some of the big differences are population numbers. And of course, the urban setting is very different than like a rural, remote setting of which is most of Alaska. But also, public health nurses in Alaska work at 3 different levels. We have kind of like a 3-legged stool approach to public health nursing services. And those 3 legs are focusing on systems, communities, and individual client-based care. And when I worked in Kansas City, Missouri, I worked in a refugee health screening clinic and a TB clinic. So the focus was really on an individual and a family. So we didn't really get into systems. But up here in Alaska, we have a 3-legged approach.
So COVID has hit Alaska. Tell me sort of how it has progressed there. Has it been different than in the rest of the United States?
Yeah. It's progressed much like in the United States. So, we're going over 2 years of trying to unpack how we are going to have healthcare systems and communities face this unique global health threat. So I guess in regards to incidents, our epic curve has really followed that of the United States as a whole. So if you step back and look at the entire US and look at that epic curve, Alaska trends or epic curves that really followed the US, but falling about 3 weeks behind. And so that's interesting because we kind of see the same thing in regards to EU and UK. And then the United States has kind of followed those trends for the past 4 waves or so. And then Alaska ends up following those trends so far. What's going to happen in the future, don't know, but that's been the trend so far.
Why is Alaska sort of a unique place when it comes to healthcare? I understand that it's very hard to access healthcare for many people. And I guess I assume that also means to get tested for COVID and treated for COVID and vaccinated against COVID.
Yeah, it's a challenge. I guess, we've got 229 federally recognized Alaska Native tribes or tribal governments. And so kind of the implication there is humans and villages are spread out across a very big state. We're actually 3 times the geographical size of Texas. So what it looks and feels like are tribes scattered across the map, and Alaska Natives make up or account for about 16% of Alaska's population. But these folks have a lot of healthcare needs. And so they've got 2 main ways of accessing healthcare. One would be village-based clinics, but also if they need a higher level of care, there are hospital hubs throughout the state. And those are kind of like level 4 trauma centers. And then folks can travel down to Anchorage or Seattle if they need higher level care. So that What does that mean? That means a lot of flights, a lot of critical care flight nursing, and that type of thing.
So in terms of COVID prevention, how has it been to organize vaccines, for example?
Yeah, I think one of the biggest advantages of our big state is we feel like a small state, and what I mean by that is I can pick up the phone and call, like, say, any tribal leader or community member. And that's what it feels like. And it's that closeness that allows us to continue working as a team to solve really tough problems. And also things like access to immunizations. Our tribal healthcare system has been around for decades. And that tribal healthcare system has been working with the state of Alaska on distributing and improving access to vaccine for decades. So in many ways, our approach is one that we've used for decades.
I find it interesting that you've had, even though everybody's so spread out, you've still had, a decent number of COVID cases. Do we know how it's spreading?
Oh, I think it spreads, just like it does in other areas of the United States. But the difference is some of them are access to care. But another difference is some tribal governments have chosen to, sign up for these mitigation measures that are more strict than, like, say, CDC or the ones that the state of Alaska are recommending. And what I mean there is, we work with some tribes that are about 200 or 300 people, and they're in Bush, Alaska, meaning they're off the road system, but they've restricted travel throughout the past couple of years much more strictly. And they've had quarantine and isolation guidelines that are several more days than what CDC is recommending.
What kind of issues does that create?
Well, it creates some challenges with getting in and out of the village for healthcare. So accessing healthcare for needs that can't be met at the village-based clinic, especially those that aren't related to COVID, some of those things have had to been put on hold until travel restrictions can be lifted by the tribal governments.
Sounds like this pandemic has highlighted the challenges that already exist in Alaska's healthcare system and perhaps exacerbated them.
You got it. But it's also highlighted the strengths, because as a public health nurse in the state of Alaska, and there's about 100 folks like me scattered out across 16 different public health centers. And these public health nurses have really focused on creating relationships with not only tribal governments, but tribal clinics. And so during the past couple of years, we've really leaned on those relationships and also expanded them in order to meet the needs of not only those communities, but the state as a whole. Without being able to pick up the phone and call these folks, I think our response to COVID-19 would be much more slow, a much slower response.
And do you feel as though, the spread out nature of the population, has that kept COVID more in check, or has it caused other challenges?
Oh, geez, I don't know. It's pretty hard to generalize, but I would say one thing is that Alaskans, we all have one thing in common, is we've got a lot of space and it's beautiful. So I think it's probably safe to say that we're more likely to get outside and enjoy the weather, no matter what the season is. And so mitigation measures like just giving yourself another's room might be more common, and I'm not sure. But access to healthcare is still a challenge. So if there's folks out in Bush, Alaska meaning you can't drive there by a road, if they need higher level of care, that means they've got to access a hospital via flight nursing. And flight nursing is a resource that is, not adequate to meet all the needs throughout COVID. And we're seeing the same with hospital capacity throughout the state. And so one real challenge has been, if all the hospitals in Anchorage are filled up, there's nowhere to go. So sometimes we have healthcare providers on the phone for 8 or 9 hours just looking for somewhere to transfer a client to higher care.
So I imagine that it's not adequate in a normal year, the healthcare system. And this obviously makes it far more evident.
Yeah, it's a real challenge, and there's different healthcare needs that kind of mirror different seasons. So in the summertime, we'll see more kind of injuries popping up as compared to other parts of or other times of the year. So, things like adult ICU beds are typically already about 2/3 full. So there's only about 1/3 of the beds available. But if you lay COVID on top of that, that means that the healthcare system is really stressed. And then some secondary impacts to that is healthcare folks are tired because they have been doing 2 or 3 things at once for a couple of years. And sometimes it's just not something we can sustain. And so we're really challenged with keeping vacancies filled throughout the healthcare system. And by healthcare system, I mean not only healthcare as we think about it like primary care and hospitals, but also public health nursing. We've got about 158 positions, and over 50% of those positions have turned over in the past 2 years during the pandemic. So that's a real challenge.
So what do you see as the path forward here? And what lessons can we take from COVID to improve public health in Alaska?
Yeah, sure thing. I don't know the future, but I do know I've noticed several folks stepping forward in leadership roles in order to start uncovering the future or what's next. So a lot of folks have turned the page and they're moving on to something different. But when I stand back and look at, say, Alaska's public health nursing workforce, there are a few handfuls of folks that I think are going to be around no matter what. And these are the folks I think that are going to pick up the lessons learned and carry them forward into the future. And so what in the world does that mean? What am I talking about? Is we've been in a continuity of operations plan or focused on 95% of our time on COVID for the past 2 years. And so that means that some employees, they just got hired 2 years ago. So all they know is COVID, but they know it well. And so those skill sets now can be developed and broadened to other public health challenges. And one that I have in mind or category is non-communicable diseases. So things like cancer and heart disease are still number 1 and number 2 causes of death in Alaska as well as the US. So I think we've got some good challenges, but I think that, folks kind of growing up professionally during COVID is a real opportunity too.
What advice would you have to someone who's interested in being a public health nurse?
One thing that I think in particular is I've been challenged and we're real challenged to answer the question, what do you do as a public health nurse? Because in Alaska, we've been around since 1893 in some form or other as a public health nurse, but most of that time we've focused on individuals like most nurses. So we just officially made the shift to population-focused healthcare in 2008. And so we don't have all the tools and the training and the organizational history to train new folks like we do with individual client care for things like tuberculosis or STIs. And so, to even answer the question, what do you do as a public health nurse has been an internal challenge, but also a challenge to speak externally to partners and tribal governments and other, municipal partners. So I guess one thing I would say is pick up the phone or give someone a cold email and talk to a public health nurse and ask them, what's the work like? And what are some things that you might recommend for a person who's interested in a career in public health nursing?
Public health has taken a bit of a beating over the past 2 years. And I'm curious how you think that is impacting you and others on the job.
Oh, I think for me, it's really drawn me and my team closer to community members, even more so than ever. I know there are folks within our organization that have been beat up pretty bad, by community members who aren't happy with mitigation or with things like recommending vaccines for everyone. But I've been pretty sheltered. I haven't really experienced that. I live in a small town. These are people I see around town. I hike ridges with them and I share kale with them. So I have this personal, but also professional relationship with them. So that's kind of been the core of not only my resilience going through the pandemic, but I think it's opening up doors to move forward. Because like I mentioned before, in terms of, real major community health threats, we've got a lot of work to do, especially as it relates to non-communicable diseases. Now, that doesn't mean that infectious diseases aren't still a threat. Things like tuberculosis they could be on the rise because we have less skilled public health nursing services to manage complicated tuberculosis cases in really remote villages.
Lauren Carroll, thanks so much for the work you do, and thanks for joining me.
Thanks for having me, Stephanie.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.